Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, the elimination of schistosomiasis in the Americas. Dr. Ronaldo Scholte is a technical officer on the neglected tropical disease team of the Pan American Health Organization. He talks with Dr. Josh Sharfstein about this parasitic disease and its complications, as well as the incredible effort over decades to push the infection to the brink of elimination in Puerto Rico. Let's listen.
Dr. Ronaldo Scholte, thank you so much for joining me today on Public Health on Call. How are you?
Good. Thank you very much for having me.
Now, you work at the Pan American Health Organization. What is your job there?
Yeah, I'm a technical officer in the PAHO, how we call it. And what I do is I try to give to the member states, the countries, help for them to achieve their goals. On my specific role, I work with parasitic diseases, and the four on my portfolio are set for elimination. So I assist the countries to achieve the goals of the elimination by 2030.
Eliminating parasitic diseases, that sounds like a very good thing to do. What does elimination mean?
Well, we have two types of elimination. We have elimination as a public health problem, where we reduce the burden of the disease on certain levels that it's not a public health problem anymore. And each disease has their own cutoff. And we have the elimination of the transmission. And that means zero autochthonous cases in the country for that specific disease.
I see. So the first kind of elimination is there might be a case here or there, but it's not causing a big problem. The second type is eliminated. It's just not there at all.
Correct.
Got it. So let's talk about schistosomiasis. I remember this vaguely from medical school as being a very, very bad disease. But could you talk a little bit about it? What is schistosomiasis?
Yeah, schistosomiasis is a parasitic disease caused by a parasite from the genus Schistosoma. We have many diseases in the schistosomiasis, but the main ones are the urinary one caused by Schistosoma hematobium that we don't have in the Americas, and the what's so-called intestinal one, even though that the parasite doesn't live inside the intestine, they are called intestinal ones, which are on our region does just occur the Schistosoma mansoni. But we have others. We have Japonicus, we have Mengongai, we have other species that cause this type of intestinal ones.
So if I'm in a country where there's active transmission, how would I get schistosomiasis?
Well, schistosomiasis, it needs to have an intermediate snail host. So someone needs to be in contact with a water body, with this snail infected, releasing cercaria. So these cercarias will actively look for a mammal final host, and then the human is included on that, and actively penetrate the skin, and then start the cycle on this person.
So as I understand it then, if I were to go, for example, swimming in a lake that is actively infected, that these cercaria could swim up and go right through my skin and enter my bloodstream.
Correct. And one cercaria is not the problem. The problem is when you have many cercarias, because each cercaria will transform in one adult worm, one sex of adult worm. So you need at least two, female and male, to start to have the disease problems.
Got it. And so it goes into my body, the female and the male get together, and then they start to breed these parasitic worms inside my intestines.
Yes, somehow. What they do is, as soon as these cercaria penetrate the skins, it goes on the bloodstream, and then it goes around the body, like changing forms and trying to getting as an adult form. So when they get in the adult form, the male and the female goes to the mesenteric veins
I see.
and they start to couple. And then the female start to lay eggs. Those eggs could go for across the intestinal walls, go to the intestinal lumen, and go out with the feces. But the other parts stay in the bloodstream, and then it's where it causes the chronic part of the disease.
I'm not sure I really needed to hear all that detail, but it is very, very interesting. So, what is the chronic part of the disease?
Well, the chronic part is when the eggs cannot go out of the body through the feces. And then it stays in some places, like on the intestinal wall. And then it happens all the reactions and transform the egg in a granulome. And then some eggs could go for the liver, and it's where the most part of the problems start, because these granulomas starts to stay there on the liver, and the hepatosplenic disease start.
So, basically, there are parasites all through my body and they land in different places.
Eggs.
And the eggs, and they cause all kinds of problems.
Exactly.
In some cases, very severe disease.
In some cases, very severe, because those eggs could land on the spinal cord, cause paralysis, could land on the brain, and could cause very hard problems.
Okay, you've convinced me that it's a good idea to eliminate this disease, Dr. Scholte. It is possible to treat schistosomiasis. If someone is infected, you can give them medicine. Is that right?
Yes, schistosomiasis is treatable. The only thing is, when you have the infection, that means the environment is infected. That means the water body behind people's house are infected. And if you have a kid infected, that's because they are having fun on the river or the pond or the lake. We are talking about poor people without a lot of resources. So even though it's treatable, this kid or this person could get infected again.
And if they don't get the treatment in time, they could suffer very serious consequences.
Yeah, they could have chronic problems, like I mentioned before, liver related, paralysis related, intestinal related. So they could have a lot of issues.
This is a great example of why it's so important to prevent rather than just wait for people to get sick. Okay, so tell me about this idea that PAHO is trying to eliminate diseases, including schistosomiasis.
Yeah, it's an initiative, an important initiative, because if we could have one less person going to looking for the health centers, seeking for care, the countries could reduce their amount of money spent in health. So, and we have diseases that's possible to eliminate. That's the case of schistosomiasis. And it causes a lot of issues, As I mentioned before, schistosomiasis in general, it's the most important neglected tropical disease. And it's among the parasitic disease, it ranks second, losing only for malaria in terms of global morbidity. So it caused a lot of problems. It caused a lot of issues for the health system of the countries.
Right. So let's roll up our sleeves here. Tell me, in the Americas, how many places does schistosomiasis exist?
Well, we have 12 countries which are historically endemic for schistosomiasis. 3 of them, which are in South America, still have the transmission going on. That's Brazil, Venezuela, and Suriname. And then we have 9 of these countries which are on the Caribbean region, which we believe that eliminated the disease, eliminate the transmission of the disease, and are ready for verification, for the verification process, for us to be sure that they already eliminated.
And when we're talking eliminated, are we talking about eliminated as a public health problem or eliminated transmission?
No. For the case of schistosomiasis in the regions of the Americas, we are talking elimination of transmission. And that means 0 cases acquired in the country in the last 5 years.
Got it. So there may still be some snails out there, but
Correct.
they're not infecting humans.
Correct.
And Puerto Rico has been one of the sites for schistosomiasis. And I saw this announcement from PAHO that there's been some progress. Tell me about that.
Puerto Rico, it's one of the 9 islands in the Caribbean region, which did everything by the book since the 1950s, 1940s. So Puerto Rico started elimination program or control program at that time, and they start with preventive chemotherapy. So they treat everybody at risk. So they use snail control to tackle the intermediate host snail. And of course, during the years, they had a lot of improvements with water, sanitation, and hygiene. They have a lot of development socioeconomic in the island. So that made the transmission starts to decrease by the time. And right now, we don't see any more cases since before 2000.
And so the PAHO recently made an announcement about Puerto Rico. Is that correct?
Yes, PAHO assisted Puerto Rico with a snail survey. We have here, it's a joint venture where we had the University of New Mexico, PAHO, and the Puerto Rican health authorities working on this snail survey. And what they reported showed that we cannot find the intermediate hosts anymore in the island. It doesn't mean that they don't have anymore the snails, but it means that the possibility for the transmission is almost zero because on the place that we surveyed, we didn't find the snail.
How do you do a snail survey?
Well, what we need to do is first to plan it carefully. We need to have a detailed information about water bodies in the place that we'll survey. Second, we need to have the information where the transmission occurred in the past. Then our teams go to the water bodies. Again, it's a fresh water. From water body to water body, scooping the lakes or the rivers to see if we could find the snail.
Tell me what you felt when you saw the results of this snail survey.
I was very happy because when I was there with the team, I was looking the sites, and the sites were very promising to find the snails. And those snails are very resilient. I mean, one snail could easily populate a water body in a couple of weeks because they are hermaphrodites. So when we saw these results, I was very happy, really, because to see a country on a step close to the elimination, it's very good.
This is a huge public health accomplishment because if schistosomiasis were truly endemic, there could be hundreds or thousands of people infected every year with this serious illness.
It is. It is. And what those Caribbean islands countries did, it's remarkable. It's textbook work. Because if you take the parasitology book and look at the schistosomiasis, they did everything that's written there for years and years. And now they are having these amazing results.
Well, Dr. Scholte, thank you so much for explaining this to me, refreshing my memory about this parasite and all the details that maybe I once knew, and telling us about a public health triumph that maybe we don't hear about every day.
Yeah, I mean, again, neglected tropical diseases are not diseases that are on the media every day or, have a lot of support, because otherwise they would not call neglected tropical diseases and affect the poorest of the poor in the countries of our region. So our effort here is always to assist our populations and to get a better outcome for these people.
Well, I wish you the best for all of the elimination campaigns for schistosomiasis and these other diseases. Thank you so much for joining me.
Thank you very much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.